15 minutes past the hour now. Our chief medical correspondent, Dr. Sanjay Gupta, there he is. He just muscled up, just got his second dose of the coronavirus vaccine. Waiting for him to wince. And he just got home from the hospital. Well, that was a quick change. How are you feeling?
I feel fine. I mean, you know, it's a small needle. You barely feel it going in. Sometimes, you know, with shots, the material that they're injecting is actually a little bit more viscous or thick, and that hurts a little bit. But not with this. It's fine.
I'm glad to hear it. Okay, so now how long do you wait before you can say, I have the antibodies?
Yeah, so, you know, when we look at the data around this, it's typically around 7 days after the second shot for this vaccine. I got the Pfizer vaccine. So, you know, about a week from now is when you get to that maximum protection, that 95% protection. So I'm probably got a lot of that protection already, but that's sort of that's when your immune system has sort of kicked into full gear.
So will it finally change your life in that will you finally be able to go out of the basement and not just to work, but do other things, or no?
Well, I don't think it'll change a lot, actually. I mean, I think that the biggest thing is there is a sense of relief a little bit that, you know, I'm now 90% plus protected from getting sick with COVID. I mean, that's basically what we can say for certain. What we can't say, and I think this is such an important point, Robin, we've talked about this before, is that the vaccine doesn't necessarily prevent you from carrying the virus still, from having the virus infect you and you carrying it in your nose and your mouth, even if you're not likely to get sick. It doesn't necessarily prevent you from possibly transmitting it to others. So it's really important, right? Because getting sick is the worst part of this, and you know, obviously getting sick enough to be hospitalized, that's what people are trying to avoid. But you still got to wear the mask. You still got to do the physical distancing, still do the washing of the hands, until enough people in the country can say the same thing, that I'm not going to get sick if the virus is spreading around me.
I see. Gotcha. Okay, so it's like you want to be mindful of the other people around you, even though you have the 90% protection
Exactly.
here. Now, we have a lot of questions from folks still about the vaccine. Not that most people right now can just go out and get one. We're still waiting on that. That's another issue.
Right.
This person says, should we get the vaccine if you've already had coronavirus?
Yes, the answer to that is yes, and there's been back and forth on this. It's a good question. If you've had the coronavirus, there's two issues. One is people will ask, is it unsafe to get the vaccine? No, it's not unsafe to get the vaccine if you've already been infected. People who had been infected were part of those initial trials. But the second thing, Robin, it's a little bit more a subjective issue, is that if you've been naturally infected, how long does your immunity last as a result of that natural infection? We don't know for sure, but there have been some cases of reinfections, so we know the immunity that you get doesn't last forever. The vaccine should give you longer and stronger immunity. So the answer is yes. When it's your turn, even if you've had the infection in the past, go ahead and get vaccinated.
But when's it going to be our turn? What is up with the, like, nearly 6 million doses of the vaccine have been administered, but there were a lot more made. Where are they?
Yeah, I know. Look, this has been disappointing, Robin, to be frank, you know, because there was supposed to be 40 million doses, you remember, by the end of last year, meaning enough doses for 20 million people, because it's 2 doses per person. It's been slow, and what's surprising, I think, to a lot of people, it's not an availability of vaccine issue. The question was, is the manufacturing going to be able to keep up? That hasn't been the problem. The problem has been, as you point out, actually then getting the shots delivered once, you know, these institutions are having them. I can tell you, so I was at Grady this morning, where I got my shot, healthcare workers getting vaccinated there. Grady is also as busy as they have been throughout this pandemic in terms of taking care of COVID patients. So they're so busy, and they're also responsible for inoculating, you know, all their healthcare workers. They're going to start doing people over the age of 65 within the next several days as well. But it's just a really overloaded system. So you have 2 of these competing interests, taking care of all these patients at the same time trying to vaccinate people. It will get better. It's just a question of, will it get better fast enough? If we want to get by the end of May to that sort of herd immunity number, we would need to be doing, I just did the math on this, need to be doing close to 1.5 to 2 million vaccines per day would need to be delivered. And we're not close to that right now.
Gotcha. I just did the math on that. Yeah, I'm thinking about the people at Grady then, and if that is equally the same other hospitals, where you want to prevent having more patients with COVID, and to do that you'd have to administer the shot, but you can't get your your whereabouts because you're treating the current COVID patients. How do you find out which group you're in? Are you supposed to sit around and wait for someone to call you?
This can be really challenging. Yes, I mean, on the CDC's website, they give the various groups, so 1A, 1B, so you get an idea of where you fall in line. There's various trackers to do this as well, but it's been a bit ad hoc, Robin. I got to tell you, even my own parents, who I've talked about on your program, they live in Florida, in Lee County, Florida. They're both over the age of 75.
Oh, there they
so they
are.
were in these groups. Yeah, so, what they did was they went online. And they just found out that at the county library where they live, there was going to be 300 doses that were going to be administered. This is last Wednesday morning. So they went outside on Tuesday night, 1:30 in the morning, Wednesday morning, and waited. Like they were waiting in line to get, Grateful Dead ticket concerts, and they got the numbers. I don't know if you can see that on the screen, but they were told there was 300 doses, and they were 288 and 289.
Isn't that something?
And they waited outside for 10 hours to get it. So that's what it's like in some places. Again, I do think it'll get better, and it's been better than that in other places in Florida even, but it's been very uneven so far, Robin. I think, people still don't know when their turn is, how to find out. It's challenging.
Yeah, but yet some of those doses exist, and that's maddening that they're not getting to the people. Dr. Sanjay Gupta, thank you very much. But you got your second dose, so you can continue to take care of people as you do as a neurosurgeon, and we appreciate it.
You got it, Robin. Thank you.